Hi, Dr. Michael Krochak from the New York City Smile Spa, and I am just teaching our patient Maddie here proper tips for oral hygiene. So, brushing, Maddie. I highly recommend an electric toothbrush, way more effective in removing the plaque. My favorite one by far is the Oral-B Braun because the head is very small and reaches into the nooks and crannies better than a larger head. The Philips Sonicare is very popular. It's okay, but the head is larger and it is dependent as well on ultrasonic waves that if your teeth aren't straight are going to bounce off and not reach everywhere. So if you have perfectly aligned teeth, the Sonicare works okay, but that's the reason why I prefer the Oral-B, because mechanically it gets in better.
Got it.
So key is that all the plaque accumulates under the gum line. So you want to take the bristles 45 degrees at the gum line, so half tooth, half gum, and you work your way slowly around. Vision that you're just painting your gums versus brushing your teeth. You go on the inside, move the tongue out of the way, etc. And then you go back 2 or 3 times slowly around. Now, as a kid, you were taught to brush up here, and you can do that quickly, but as an adult, we're more concerned about periodontal disease, and it's all about the gum line. Now, when you get between the teeth, you can actually push a little, and you see it goes in between it as well. So that's the best way of brushing, and you should do that minimally twice a day.
Got it.
So let's go over flossing.
Okay.
Despite the brushing efficacy, the bristles don't get between the teeth perfectly, and if you don't break up the plaque, then you're going to form tartar, which is calcified plaque, which really inflames the gum and causes bone loss and periodontal disease. So I have 3 huge tips that I give all my patients on flossing. Most patients wrap their index finger with the floss. Tip number 1 is not to do that, and to wrap the floss around your middle finger, mostly on one, a little on the other, and then every few teeth you take a clean piece. The reason is you have more dexterity in your index fingers than all your other fingers. So if you keep them free, you can control the floss. Tip 2, you're flossing a small tooth. The biggest mistake is patients try to control the floss the size of your face instead of the size of a tooth. So like in baseball, choke up on the bat and only control a small piece, and then you'll be able to control it better. Tip 3 is when you go between your teeth, to get it between your teeth, it's a seesaw and it pops below the contact. And most people floss only from here to here, to the gum line. But there are 2 separate teeth. If you look at the gum, it's a triangle. You have to go down 2 sides of the triangle. So once you get it in, curve it like a C to the right, and watch how that slips all the way under the gum. And just removing the plaque from that tooth only. So when you're between these 2 teeth, you now have to curve it the other way, to the left. And now you're going under that gum line. And then you're out. And then you go to the next one. To the right, up and down 2, 3 times, to the left. And then also, like I said, if you're grabbing a small piece, look how easy it is to reach back here. All the way between your back 2 teeth you can get in. Okay? Curve it this way, curve it that way. So what are the 3 tips? Middle finger, small piece, make a C. Got it? All right, excellent.